People need to be needed and animals need people. Studies show that people who own animals or have them in their life have less stress and a better physical well-being. Not only are animals cute and fuzzy, they're little companions who will love you and want to be loved back. I have visited nursing homes when I was in Votech, and the ones who didn't have animals, I was more likely to find upset and angry patients who just want to be left alone. Today, I would like to speak with you about how every nursing home should have at least one pet, a furry companion for the residents to love and bond with, or some erotic fish to look at. In order to understand why this is so important, we must first see how residents are without the pets and then how much of an impact they have on the resident's life. Not all elderly people who live in a nursing home have family and friends that visit them. This can make them even more depressed than they already are or even grumpy. No one in life wants to be alone. You always want someone or something to share things with. Depression is common and over 40% of elderly live in a nursing home. It is a very serious matter and can result in greater health problems. Memory loss or confusion, lack of appetite, irregular or unhealthy sleeping habits, and in some cases, even thoughts and attempts of suicide. Many patients already take a numerous amount of drugs for health problems. And with that being said, most of them don't want to have to take any more. Patients' behavior prior to having pets in the nursing home was fairly negative. Mr. Ken Whitehouse, 75, a member of the New Haven Convalescent Center nursing home, is a prime example. He was very antisocial, stayed in his room most of his time. Mrs. Barbara Hawkinson, 87, a member of the same nursing home, thought about herself often and how different things are compared to what they used to be, which tend to make her very sad. While it may seem there is no hope to help these patients or some of their medical conditions, that is very false. And the best part is, this can be done without the distribution of more drugs. Animal therapy in nursing homes should be required because of the proven things it can and has done for patients. Animal therapy has made patients' health better. Studies have shown these positive changes in patients' health, like a reduce in blood pressure and cholesterol, and even patients being relieved of depression has been an outcome of this. It helps patients feel more alive. Mr. Whitehouse, who was very antisocial and stayed in bed all day, is my favorite example of this. When Lucy, a black and brown mutt, came to the home, it made Mr. Whitehouse more alive. He wanted to take care of her. Mr. Whitehouse now gets dressed every day and makes a bed for Lucy in his room. Best part of it all, his physical health has stabilized. It's crazy how something so small can give great effects like that. And Ms. Hawkinson said when she's around the animals, she's not thinking of herself anymore. She's busy watching the dogs, and it changes her inside. Animal therapy has also gotten patients more involved. They participate more in activities that the nursing has, and they also are more social than they ever have been before. Some patients even feel safer with the animals being there. Animal therapy should be oriented in all nursing homes. It yields nothing but good outcomes for the patients and makes their last bits of life living better, physically and mentally. As a result of animals living in the nursing home with the patients, the caregivers and nurses are seeing a phenomenal increase in the patient's overall well-being. The patients are more happier and even healthier. There really is no downside to this method. The patients are benefiting just as well as the animals. I hope that my brief speech about animal therapy in nursing home helps the elderly helps you understand that there is ways other than drugs that can be demonstrated in homes to help the patients have a better life. I'm sure everyone has had someone they love in a nursing home or has known someone, and sometimes you can't always be there for them, but the animals can. If something so small as patients being around animals can make big changes in their health and well-being, it should be required in all nursing homes. Barbara Farland, the therapeutic recreation consultant for the State Department of Health Services, said this: "As recently as 5 years ago, there was a real question about the use of pets in nursing homes because some felt they might get in the way of patient care. But now there's a real trend toward it. Pet therapy programs for the elderly, they work. And people need to be needed, and animals need people. So please change your mind on this and help for animal therapy to be in every nursing home." Thank you.